Should you encounter a patient or other person who is displaying the classic signs of choking, such as hands held to the throat, struggling to breathe but without air movement, or high-pitched wheezing or whistling sounds, you should be prepared to help the patient clear his airway.
Okay. Can you breathe? And sit down. Can we get some help over here, please? You okay?
Choking does not commonly occur to patients who have experienced a submersion in water. Water does not act the body to obstruct the airway. You should immediately provide rescue breathing or CPR for submersion victims. If the patient is choking but is able to breathe on his own, simply encourage him to cough forcefully. Do not attempt to clear the patient's airway.
Doing good, doing good. Keep it going. Good job. Good job.
If the patient is unable to breathe but is still conscious, move into position behind him, wrap your arms around his abdomen. You should position your first hand in the shape of a fist, thumb side in, just above the belly button, and place your second hand on top of the first. With forceful movements, pull backward and upward at the same time, compressing the abdomen and diaphragm to force air from the lungs and clear the airway. Repeat this procedure, called the Heimlich maneuver, until the patient's airway is cleared or until the patient loses consciousness. If the patient becomes unconscious, gently lower him to the ground. Perform an initial assessment, including initiating your emergency assistance plan and calling for emergency help. Begin CPR. After completing the chest compressions, open the airway and inspect the mouth. See if the obstruction has become dislodged and remove it with a gloved hand. Deliver 2 breaths. Continue this cycle until you are able to remove the obstruction, deliver successful rescue breaths, or help arrives. If you are alone and are choking, you can perform abdominal thrusts on yourself. If this does not work, try to compress your abdomen by quickly pressing it into the chair back, railing, or similar surface. Abdominal thrusts and chest thrusts can cause internal injuries. They should never be given unless clearly necessary. However, when required, they can be life-saving. A patient who has experienced a complete airway obstruction that is removed by abdominal or chest thrusts should be evaluated by EMS or seen by a physician to ensure no internal injuries resulted from the events.